First of all, what is earwax? Earwax is a combination of dead skin and something called cerumen, which is the oily substance produced by the ear, and its role is to protect the ear against infection. The cerumen has antibiotic, antifungal properties, but most of the bulk of earwax that we see is actually just dead skin, because skin in our ear doesn't flake off like it does on the rest of the body. It's got a little conveyor belt. So if you put a little black dot in the middle of the eardrum, about 6 weeks later you'll find that halfway down the ear canal, and that all builds up. And in most people it's entirely self-cleaning, but in some people it isn't, and they need help to get rid of it. So obviously you can buy over-the-counter products that soften it and maybe help it come out, but that doesn't work for everybody. And then if you need to get somebody from a medical background involved, you've got the options of either having the ears irrigated or cleaned out with microsuction. Irrigation has been around a long time. Traditionally involves having to have the earwax softened in the run-up, so you need a period beforehand, and then you have the ear washed out. The problem with that is not done under direct vision, so there are risks of trauma to the eardrum and infection after it. So microsuction is widely regarded as a much safer practice because it's done under a microscope, so you can see exactly what you're doing, and it's much more targeted. But it's not without its risks either. It can be a dangerous weapon in the wrong hands, trauma to the ear canal, to the eardrum. But there are additional concerns with microsuction, and that these are rare but real in terms of patients complaining of tinnitus, or on the rare occasion hearing loss that's been related to the microsuction that they've had. So the Zephyr was very much designed initially from a practitioner's perspective in terms of what are the issues that we have utilizing microsuction, and actually then what benefits does a patient get from that. And the issue is that it's noisy for us to perform microsuction, and if it's noisy for us, can you imagine how noisy it is when that's coming into your ear? I don't need to imagine, I've had it done. And so how can you mitigate that and make it as safe as possible while having complete control over the amount of suction required? So the principle of having the control is the button that you can introduce a sucker into the ear entirely silent, put it on the wax and take it out. And most people have firmish wax where that's possible. When there is more liquid wax, the property of that makes more noise within the sucker, and therefore being able to reduce the amount of suction pressure is really beneficial. And in that situation you want to introduce the sucker with a small amount of suction still going, but so it remains very quiet compared to conventional sucker. And then with that wet wax, the other issue as somebody who performs microsuction is it blocks the sucker all of the time, and that's incredibly frustrating. And so the other aspect of the Zephyr, designed to make that a better experience for the practitioner, is the fact that it is at its narrowest at the very tip. So if you get some wax on the tip, that can be wiped off, but what it shouldn't do is block once the substance has got inside.